the idea is to bring a diverse group of people together to discuss complex issues around healthcare workforce. Whether it's the demand for the workforce, the supply, so how many do we have, how are we measuring who we have, or whether it's some of those issues that are policy related, such as how are our regulations, what were bills in the last session that we had, and what were some of those that made it across the finish line, and what are some of those that we're going to potentially revisit in upcoming sessions. So this is a platform for discussing all of the issues that affect health workforce, and we're really excited this year. The theme for this year's summit is workforce alignment in the health sector, and so we actually have Dr. Christina Box from the State Department of Health. She's going to be talking about population health as a demand factor. And then we have Commissioner Fred Payne from the Department of Workforce Development, who's going to be talking about demand from the employer perspective and economic development perspective. So they're kicking off the day with back-to-back keynotes. And then throughout the day, we're actually going to be hearing from a number of organizations and stakeholders that actually responded to a call for ideas. And so through the call for ideas, we really identified that we had three topic areas that emerged. One of those very clearly was workforce development, just as a theme. So we have an entire track dedicated to workforce development in the health sector in Indiana. How is Indiana leveraging, for example, federal funding for health sector workforce development, and various other topics in that track. The second track is Indiana priorities. So we're actually going to hear from Indiana employers, such as the Hospital Association, Indiana Healthcare Association, and the Indiana Primary Care Association on what do employers need. So where are their needs at, and actually where do they project their needs going, which is critically important for workforce alignment in the future. And in addition to our employers reporting on the demand, we're going to hear on Indiana health priorities. So we're going to hear a session on infant mortality and what work are we doing right now in the health workforce space to address infant mortality here in Indiana, and then also obviously the opioid epidemic. So we're going to be hearing about the workforce initiatives related to attacking the drug epidemic. We're really excited about that.